Dying and grief are uniquely personal, yet these experiences and feelings cannot be separated from who we are or from the cultures that inform the development of our values and beliefs. Cultural diversity in relation to healthcare, dying, and grief will show in many different ways. Some of these ways include religious views, death practices, and different languages. It is so important for physicians, nurses, social workers, and all healthcare professionals to challenge their own beliefs and become more culturally competent. So, what is cultural competency? Cultural competency is the ability for providers and organizations to provide the best resources to clients or patients based on their social and cultural needs. In relation to the dying process, cultural competency might mean understanding a patient and their family's language barriers and getting an interpreter that they are comfortable with. It also might mean finding a quiet space for families to grieve in a way that matches their needs, and asking questions such as how a patient and their family understands the illness and what the next steps are. It is important to know that it's extremely difficult to become completely culturally competent, so being culturally aware is something to strive for. Without healthcare professionals striving for this goal, patients and families will suffer. Medical professionals and anyone on a patient's team needs to be open and honest with patients. Being aware of one's own biases can help give better resources to patients and families.
Language barriers within hospitals, nursing homes, funeral homes, and many more places often run into issues between understanding one another and the ability to communicate to those that do not speak the same language. In the U.S., most patients speak English, but many often speak Spanish, French, or other languages. They may have difficulty communicating what they really want or need, especially in medical or end-of-life situations. Without bilingual employees or interpreters, people may have difficulty communicating with each other. Cultural competency has 4 components: awareness of one's own cultural view, attitude towards cultural differences, knowledge of different cultural practices and worldviews, and cross-cultural skills. By using interpreters or hiring bilingual staff workers, we will be increasing awareness of cultural differences and practices, along with providing them with the help they need by giving them someone who can speak multiple languages so that they can better understand you and your needs. A recent example of language barrier affecting death is a death of a 2-year-old showed problems that have risen between language barriers and death that occurs in the medical field. The family is from Mexico but was in Nebraska, and none of the family speaks English, and one of the children fell ill. Many English-speaking doctors examined the child, and the condition wasn't major until breathing got worse and her heart stopped twice on the ER table. The doctors told the family she had liver problems, but the infection in her brain killed her. The father is upset because he knew she had a fever for a reason, but they were told to go home instead. The father thought they should have ran more tests, but because of the language barrier, the father could not get his message across. With translation services and interpreter or bilingual workers, the father perhaps could have gotten through to the English-speaking medical professionals in order to speak his mind about what his daughter needs and what tests should have been done on her to prevent her death. In order to fix this issue, providing translation services to overcome barriers is crucial. In addition, hiring bilingual workers along with interpreters would be very beneficial.
Religion is often the most overlooked concept under the cultural competency umbrella. Religion is seen as one of the most important influences on an individual's daily life while undergoing medical treatment. Religious competence requires caretakers to be open, aware, and appropriate when working with patients. In the United States, 84% of the population self-identifies as religious, and the majority identify as being a part of the Christian faith. Different religions have different nuances. Can you receive blood transfusions? Do you have any dietary restrictions? Or what is the end-of-life care like? Part of being a healthcare provider is learning to understand a patient in cultural context, and that includes religion. Religion and culture are inseparably related, so it is important to understand and respect patients' backgrounds and beliefs.
So now that you know about some of the ways that people differ culturally, what can you do to improve your cultural competence? In order to be culturally competent, you must be open to learning about other cultures than your own. You can start by reading scholarly articles and literature. And do not underestimate the importance of memoirs, as they provide a personal insight to culture. Documentaries are also a fun and visual way to learn more. Another way to gain competence is to use an assessment tool. There are plenty of tools online that can help you gauge your personal knowledge and biases. Understand that not everyone can know everything. If there's a colleague who has experience in the culture you are working with, ask for their expertise. Although it may be out of your comfort zone, asking a patient and their family how to best address their needs can be incredibly helpful. Acknowledging your differences and offering to become more educated will be greatly valued by the patient.